First, on October 10th, the College of American Pathologists released a 16-page report on how private payers are interfering with the practice of healthcare, especially laboratory medicine. Second, you may have heard how Google NotebookLM will make an automatic podcast on any topic that you upload. Yep, here it comes.
Hey everyone, and welcome back. Today we're doing a deep dive into something that affects all of us. It's how private insurance practices impact healthcare. We're going to be looking at it from the perspective of pathologists.
Yeah.
You know, they play just a super crucial role in our diagnosis and treatment.
They are. They're the doctors behind the scenes. They're the ones analyzing all the lab tests and the biopsies. You might not always see them, but their work is absolutely vital.
Exactly right. So our guide for this deep dive is a white paper from the College of American Pathologists.
Okay.
It's titled, Examining the State of Healthcare's Private Payers and the Adverse Impact of Insurance Interference. So buckle up, because we're going to uncover some pretty surprising realities about the healthcare system.
Yeah, you might be wondering, how did we even get to this point where insurance has such a huge influence over our healthcare?
Yeah.
Well, one key factor is just the increasing consolidation of the health insurance industry.
Okay, so let's unpack this a little. What does consolidation really mean? And, why should we even care?
Imagine if you only had one or two grocery stores in your entire town.
Okay.
You wouldn't have much choice in terms of price or selection, right?
Right.
Well, that's kind of the limited choice that we're facing with health insurance in a lot of areas these days.
Because a handful of big insurance companies are calling all the shots.
Exactly. The American Medical Association found that in 90% of U.S. metropolitan areas, at least one insurer holds a 30% or greater market share.
Wow.
And in almost half of those markets, a single insurer dominates with at least 50% of the market.
Wow. That is a lot of power concentrated in very few hands. So does that mean they can basically just dictate terms to healthcare providers?
You got it. This consolidation just gives insurers so much leverage. They can impose things like rate cuts and increased administrative burdens on doctors and hospitals.
So it sounds like they're really playing hardball, and the physicians are left just scrambling to try and keep up.
It's a constant struggle. And then you've got the No Surprises Act, which was intended to protect patients from those surprise medical bills. Noble goal in theory.
Absolutely. Nobody wants to get hit with a massive bill they weren't expecting.
Exactly. But the implementation of this act hasn't been without its flaws. Some insurers have seemingly found ways to actually use it to pressure physicians even more on rates, essentially pushing them out of network.
Oh, so it's kind of backfired in a way. What's the impact of that?
Well, a 2023 survey found that 81% of providers in hospital-based specialties had at least one contract terminated by an insurer.
Oh, wow.
That means fewer choices for you when it comes to actually finding doctors within your network.
Yeah, that's really alarming. It just seems like there's this constant tension between insurers trying to save money and patients needing to access quality care.
Yeah, that tension is at the heart of this issue. And what's really fascinating is the stark contrast that we see between the financial realities of insurers and those actually providing the care.
What do you mean?
While a lot of healthcare providers are just struggling to keep their doors open, insurers are reporting these record profits. Take United Health Group, for example. They raked in $22.4 billion in profit in 2023.
Jeez.
While simultaneously pushing for intensifying medical and operating cost management.
Wait, so they're making huge profits while also trying to squeeze costs even further. That seems a little backwards.
Yeah, it really raises the question, at what point does cost management start to directly impact the quality of the care that you receive? And then there's the role of third-party consultants. Companies like Multiplan, they essentially help insurers find even more ways to reduce payments to providers.
Oh, so it's like this whole system that's designed to minimize cost, even if that means impacting patient care.
Yeah, that's a big concern, and it leads us to the heart of the problems that are outlined in this white paper. Are you ready to kind of dive deeper?
Absolutely. Let's get into the nitty-gritty of how these insurance practices are actually impacting healthcare. All right, so we talked about how insurance companies have gained all this power and they're using it to control costs. But how is this actually playing out, in the doctor's office or at the hospital? What are the specific problems that pathologists are facing?
Well, one major issue is something called network manipulation.
Okay.
You might be surprised to learn that insurers actually steer patients towards certain doctors and hospitals.
Really?
And it's often not in your best interest as the patient.
Steering. That sounds a little shady.
Think of it like your GPS giving you directions to a restaurant you didn't even want to go to just because it's the cheapest option.
Okay.
Steering is kind of like that. Insurance companies nudge you towards providers with the lowest reimbursement rates, even if they're not the best fit for your needs.
So it's all about saving money for the insurance company, not necessarily about me getting the best care.
That's a really valid concern. And then you have something called tiering. It's basically categorizing healthcare providers into different levels.
Okay.
And this can impact how much you pay out of pocket. Again, pushing you towards certain providers, even if you'd prefer someone else.
It's like they're limiting my choices without me even realizing it.
Exactly. And remember those designated diagnostic provider requirements from United Healthcare we mentioned earlier?
Yeah.
Those are prime examples of steering. They're essentially penalizing you for choosing a non-DDP facility, even if you have a good reason.
Yeah, it's frustrating to feel like I'm getting punished for trying to make my own healthcare choices. Are there other ways that insurers are interfering with patient care?
Absolutely. Another big problem is just reduced reimbursement rates.
Okay.
Insurers are constantly cutting the amount that they pay to healthcare providers, often to levels that are just not sustainable.
So the doctors are getting squeezed, and some are even forced out of network.
Exactly. The white paper points to Anthem Blue Cross Blue Shield as a particularly bad example. They've been known for offering these take-it-or-leave-it contracts, forcing pathologists to just accept lower rates or risk losing patients.
That seems really unfair.
It is. And it's not just unfair to the doctors, it impacts you directly. When pathologists can't afford to stay in network, it limits your choices and can lead to delays in diagnosis and treatment.
So like my biopsy results might take longer because my doctor's at a network.
That's definitely possible. And speaking of delays, let's talk about non-standard coding requirements.
Great. More confusing insurance jargon.
I know it sounds technical, but it's important. Insurers often implement their own specific codes that deviate from standard medical billing practices.
Why would they do that? It seems like it would just make things more complicated.
Well, from their perspective, it's another way to control costs. But for doctors and hospitals, it creates a real bureaucratic nightmare. It leads to claim denials and delays in getting paid.
And what does that mean for me as a patient?
It means that your treatment could be delayed because your doctor is stuck in this fight with the insurance company over these coding issues.
I guess I never really thought about how much these behind-the-scenes battles impact my actual care.
It's a hidden side of healthcare that most people just aren't aware of. And here's another example. Remember those DEXZ codes that United Healthcare requires for molecular pathology claims?
Ugh, codes.
It might sound like technical jargon, but what it means for you is potentially longer wait times for your test results as your doctor has to jump through all these hoops.
So it's just another way for them to slow things down and potentially delay my care.
You're catching on. And speaking of delays, we can't forget about prior authorization and utilization management. Those are some of the biggest headaches for both patients and providers.
Okay. Break those down for me.
Prior authorization is when your insurance company requires your doctor to get approval before they can provide certain treatments or tests.
So even if my doctor thinks I need a specific test, the insurance company can just say no.
Unfortunately, yes. The American Medical Association found that 93% of physicians have actually experienced care delays because of prior authorization. Imagine you're in pain or you're worried about a health problem and you have to wait weeks or even months for the insurance company to give the okay.
Yeah, that's terrifying. It makes me feel like my health isn't really in my own hands.
It's a valid concern. And utilization management is a similar concept. Insurance companies use all these different tactics to control the amount and type of care that you receive.
So they're trying to limit what treatments I can get, even if my doctor thinks they're necessary.
In some cases, yes. They might require you to try cheaper alternatives first, even if they're not as effective. And just add another layer of complexity, we also have these laboratory benefit management companies, or LBMs.
LBMs, that sounds kind of ominous.
Think of them like the gatekeepers for lab tests. They decide what tests you can get, even if your doctor thinks it's necessary.
So it's yet another hurdle between me and the care I need. It's starting to feel like a conspiracy.
Well, it's not a conspiracy, but it's definitely a system that often prioritizes cost-cutting over patient well-being.
Okay, so we've unpacked a lot of problems here. It's kind of overwhelming to think about how much influence these insurance companies have over our healthcare. But is there any hope? Are there any solutions on the horizon?
Yeah, it feels like we've uncovered this whole web of insurance practices that are making it harder for both patients and doctors to navigate the healthcare system.
Mhm.
But, knowing about these issues is the first step towards change, right? So, like, what can we as patients and, concerned citizens actually do about this?
You're absolutely right. Awareness is key.
Yeah.
And, now that you kind of understand all these complexities of insurance interference, you're in a better position to actually advocate for change.
So, what are some concrete steps that we can take? Should we all be writing angry letters to our insurance companies?
While expressing your concerns directly to insurers is a good start, there are some more impactful ways to make a difference.
Okay.
For starters, focus on your local community.
What do you mean? Research specific examples of insurance interference, right in your own area. Has your local hospital been affected by these restrictive network policies?
Okay.
Are doctors in your community struggling with low reimbursement rates?
So you're saying I should do some digging and find out how these issues are playing out, like right here in my own backyard.
Exactly. Once you have a better understanding of that local landscape, you can actually start making your voice heard. Attend town hall meetings, contact your elected officials, share your concerns. Yeah, let them know that these issues really matter to you and that you want to see some real change.
It's about bringing those personal stories and experiences to the forefront.
Precisely. Remember all those shocking statistics we talked about, contract terminations and care delays?
Yeah.
Put a face to those numbers. Share how insurance interference has impacted you or somebody you know.
Yeah, that makes it more real and relatable to those lawmakers.
Absolutely. And another powerful way to make a difference is by supporting organizations that are fighting for healthcare reform. Groups like the College of American Pathologists, they're actively advocating for policies that protect both patients and providers from all this insurance overreach.
So we can donate to those organizations, or volunteer our time, or just help spread the word about their work.
You got it. By supporting those advocacy groups, you're amplifying their message and you're helping them push for some systemic change.
It's like joining a collective voice to demand better health care for everyone.
Exactly. And don't underestimate the power of your individual choices. When you're choosing a health insurance plan, don't just focus on the premium. Carefully look at their policies.
So I should look beyond the basic costs and dig into the details of their network and their reimbursement rates and their utilization management practices.
That's right. Ask questions, demand transparency, and ultimately vote with your wallet by supporting insurers that actually prioritize patient care over profits.
It's about being an informed consumer and making choices that really align with our values.
Precisely. And finally, and maybe most importantly, stay informed and stay engaged. Healthcare is constantly changing, and these issues aren't going away anytime soon.
So we need to keep learning and keep asking questions and keep pushing for a better system.
That's the spirit. This isn't just about pathologists or even healthcare professionals. It's about all of us. Access to quality, affordable healthcare is a fundamental right, and we need to fight to protect it.
Well said. This deep dive has definitely been an eye-opener. We've learned about the complex ways that insurance practices are impacting healthcare, and most importantly, what we can do to actually make a difference.
Remember, change really starts with awareness and action. By working together and advocating for a more patient-centered healthcare system, we can create a future where everyone has access to the care they need.
I love that. Well, thanks for joining us on this deep dive. We hope you feel empowered to take action and be a part of the solution. Until next time, stay curious and stay informed.